Support for this work was provided by the New York State Health Foundation and Care Compass Network.
Thank you for joining us. My name is Jack Salo. In this segment, we interview Alexis Pleus, Executive Director of Truth Pharm. Truth Pharm is a small organization doing great work with substance use, harm reduction, and advocacy. It is notable that Truth Pharm was a newly formed, all-volunteer organization prior to becoming involved in DSRIP through Care Compass Network. Ms. Pleus shares the journey of Truth Pharm and the multiple benefits to their organization by engaging with Medicaid reform. While DSRIP is winding down at the time this presentation is being completed, Truth Pharm is now positioned to take advantage of value-based payment opportunities.
My name is Alexis Pleus, and I'm the founder and executive director of Truth Pharm. Our organization raises awareness, reduces the stigma, educates the public, and advocates for policy change to reduce the harms caused by substance use. So we're very specific about that because we're not really an anti-drug organization, we're really an anti-harm organization. So we take the approach that we understand that there will be people at all times using substances that are not interested in quitting or not ready to quit. And so we like to do whatever we can to keep them healthy and alive while they're actively using. We've been very careful to ensure that we are directing them towards doctors who will probably not stigmatize them. And so that's a big fear for people who use drugs or are addicted, that if they go to the doctor, they'll be judged or shamed. And that's why a lot of people don't go to the doctors, and they end up going to the emergency room or being hospitalized for infections that we could have helped them with much, much sooner. We have to understand that there are people who aren't going to want to quit when we're meeting with them, but we can still improve their health. It's funny how saying something so simple out loud, if I say that to a room of 12 providers, you'll see them like, oh yeah. But someone had suggested that we look into becoming a partner organization with Care Compass Network to become a DSRIP partner. And so we explored that option to see how we could help their work and they could help our work. The funding has been really significant for us as well because we were a very low funded organization before. Our budget, the year that we started with Care Compass Network, our annual budget that year was $53,000 for the entire year. So the funding has been significant. It's helped us bring on paid staff, which we didn't have before. We were a fully volunteer-based organization prior to this work. But honestly, I still view them teaching us and pushing us along in data tracking and making sure that we're tracking outcomes and keeping good records has been as much, if not more, of an impact to our work than the financial aspects. So Care Compass Network is blessing us with an IT contract, and we'll be getting a server, a secure server, secure internet and computers, and then we'll be moving over into electronic record keeping. I don't know that I know how to take the next step to be involved in the next value-based payment project unless someone approached me. I'm not sure how to seek that work out. And so working with others will probably be a good learning experience. We lean heavily on a lot of our community-based organizations that offer services that we don't offer, so like MHAST can offer mental health services and peer coaches in that way, and other addiction treatment professionals in the area. Rural Health Network has been a great help to us in terms of connecting people with things that they need to live a healthy life. So I'm sure that we will always need to partner with other community-based organizations beyond value-based payments projects. I think that all of these community-based organizations exist in a way to improve people's health because they are missed by the healthcare system. And We've all been doing this work that's incredibly important and improves people's health without payment and without being a part of the healthcare system, which we are a part of it. But this has really pulled us in, and I'm really hoping that value-based payment moving forward will continue to recognize the work that CBOs do and that they will incorporate us into their work moving forward. So currently in my capacity, I am spread quite thin, and being involved both in Care Compass Network and DSRIP and Medicaid Redesign, but then also having the cohort projects, there are a lot of meetings to attend. So that does tap into my available hours, pretty much on a weekly basis. It is getting to be quite a bit of a stressor. My advice would be to really reach out to your DSRIP provider, ours is Care Compass Network, and really view them as a partner in empowering your work. And I wish I had realized that sooner on, because there were other funding opportunities that I just didn't recognize that we might be able to be a part of. Once I realized that they really are investing in our future and trying to make sure that we can build capacity. Once I realized that, I really tap into them and ask them about projects before I apply for funding, run it by them, talk to them about what I'm thinking of, and then get ideas and feedback from them first. I would recommend to any community-based organization that's involved to really reach out to Care Compass Network or their DSRIP provider and lean on them for more information and to ask those questions. How do we build capacity? How do we become, have the potential to be a partner on cohort projects and things like that?
Support for this work was provided by the New York State Health Foundation and Care Compass Network.